Hello and welcome to Well with Dell. On our channel, we like to discuss a multitude of topics and find information that you'll find useful that you can use in your daily life. Today, we're going to talk about the impact of lower back pain in the workplace. If you happen to be the employee who determines the healthcare plan for the rest of the company, then you might find this very interesting with what you should be looking for when you're choosing the health plan or offering different health plans for individuals, and how it might come back and affect the company, not only with missed work days, but as well as the overall economic impact of how much it's going to cost for future years of purchasing health insurance for your company. The study I'd like to share with you today is called The Impact of Low Back Pain in the Workplace. Now, Ken Greenawalt is the CEO and chairman of the board for a company called Foot Levelers. And Foot Levelers has a passion to make sure that their end user is having optimal outcomes. They're a very good company run by very high quality individuals. Now, this article that came out was originally published in the Journal of Compensation and Benefits, January, February 2023. And it talks about the number of people that are suffering with lower back pain, as well as some of the outcomes with such care. So we're going to share that with you just now. So before we get there, we're going to talk about the different age groups that are suffering with lower back pain. And you can see that this is quite the epidemic that leads to many missed work days, as well as the cost for care. So we know that the percentage of low back pain does increase with the age. So we find that in this study, ages 18 to 29, 28.4% of those suffer with lower back pain. 35.2 from the 30 to 34 age group. 44.3 for ages 45 to 64, and over 65, we find 45.6% of people are suffering with low back pain. So the study also confirmed that jobs which require a lot of force or repetitive movements or required you to be in awkward positions that had postural deformities while you were doing your job definitely led to an increase in the lower back pain. Now, I found in my practice when people work manual labor and then they sit, say in a car, and then back to manual labor and sit, I find that transition is usually a common theme for a lot of lower back pain sufferers. So in our practice, we try to make sure that the patient is doing the proper stretches in between transitions of manual labor. Very, very important for that. We've also found with the advent of everybody using a computer now, we are definitely seeing more neck pain, which we've also found that neck problems can actually result in you feeling pain in the lower back as well. Now, they don't touch that in this study, but that's over 3 decades of being involved in chiropractic. I've been able to tell that a lot of times if you're just treating a lower back problem, people sometimes don't get better. You have to address the whole spine. And that's one thing that chiropractors are very, very good with. We look at the person as a whole. We look at the whole holistic approach. Now let's talk about some of the treatments that are out there right now that people are using and the costs associated with them. Of course, there's unnecessary surgeries, which can range from $75,000 and up at the bare minimum. We also have opioids that are being used. They're expensive, they're not very effective, and of course, the big risk of addiction does very much exist. We also have stimulators that are put into people's spine, which is a surgical implant. Very, very expensive, upwards $25,000 to $50,000. Nobody really wants to go through an implant, a surgery, so it can be very expensive and risky as well. The other thing is the non-steroidal anti-inflammatories, which can cause the stomach problems, the digestive problems. We've talked about that earlier, the effects of NSAIDs, as well as steroids. Steroids do have an effect on our overall body. They're a very powerful anti-inflammatory, but they can also cause other health problems. One thing that I see I should say I see patients that have failed injections, steroidal injections into whether it be the sacroiliac joint or right into the epidural area of their spine. These start at $4,000 per injection. Oftentimes, the pain management doctor will recommend 3 or 4 of these injections. They're very short-lived if you do experience relief. It's one of the poorest treatments out there, in my opinion. We see a lot of people back into the office that have had that done because their primary care doctor really didn't know what else to do. So they try some type of medications and then, of course, the steroid injections because they think that that's more powerful. So some people have had experience and success with that, but most of the time they wind up in here probably with further damage done on that area because the medicine was put into an area, made it weaker as it tried to reduce the inflammation. So there's many other alternatives as opposed to going those routes. So how does this impact the economic aspect of not only the insurance industry, but also your company? Well, the average employee right now costs $13,800 as far as their medical expense. That's an increase of 6.5% just from last year alone. With the rates continuing to rise like that, it's going to start to cost your company more and more. So that's one thing that you really want to take into account. Make sure when you're choosing a health plan option for your employees, choose something that offers alternative care, whether it be chiropractic, physical therapy, or even acupuncture or massage therapy. Those are things that will help the patient recover faster without the very high expense that we had talked about earlier with some of the other treatments, as well as chiropractic has proven to be very, very effective, getting people back to work faster, keeping them well longer, and it's a great idea to make sure that you keep that in your thought process when you're choosing the health plan.